Okay, there we go.
Oh, so that's where we.
Cool.
So, here we go, pretty much.
Yeah, hi.
Andrea. This is Andrea Owens. I met Andrea actually on a women's retreat in the fall. I participate with a women's ministry once a year now. It'd be cool to do it twice a year, but I can't quite swing it yet, and really the weekend is it's a spiritual renewal weekend for sure. But we were talking that weekend. I said, "What do you do?" And she said, "I'm a physical therapist." And I said, "Oh yeah, let's talk about some stuff." And when we got talking, she started to really explain that she had a real hunger for doing some work outside of clinical settings, because she was explaining to me her frustrations that happen when she can't go outside of the lines. And I said, that's really interesting, right? The story with that is that I said, that's really interesting because, well, when you're self-employed, I don't have to meet certain expectations externally from administration, basically. You know what I mean? Our rules are very simple here. It's do no harm ever. Everything that we're doing is in the direction of trying to get to the root of movement issues, and that's just kind of how it is, right? So we were talking about the timing of her making workshops.
Yeah.
And I said, when she sent me her initial outline, I said, "Andrea, I think you have a year's worth of things."
It's so
she sent me her outline, and I said, "This is definitely one solid year of video content." And so let's pull it to, like we decided on kind of like 5 big ideas, really.
Mm-hmm.
And then we started that. So I'm going to introduce Andrea that way. And I'm really excited for her to participate with you guys, because when I explained to her what happens here on our regular everyday basis, she said, "I think I have to do this." I was like, "Well, let's try it." You know what I mean? So she was excited to see how we were moving, but actually what everyone's reference points were to things, and just
yeah, like where you're coming from. What do you already know? So I'm assuming you know nothing.
Right. Andrea,
how about
That's
that?
a good assumption.
Okay. I used to be, so my name's Andrea. I used to be a regular physical therapist for 30 years. And then I developed what I thought was a recurrent UTI that just would not go away. And I kept saying I have UTI, and they kept saying, "No, you don't." And I'm like, "Yes, I do." And it turned out that I had a spastic pelvic floor. And I had to seek help, which took me months to get in, as you know. So at that point, I realized I could shift my practice. I could learn this and help other people, because it's just such a need in our field for physical therapy. It was an understood. It is still an understood whole relevant issue. Usually as a patient, not as healthy individuals, but as patients, they come see me because you're either leaking urine, you had some kind of surgery and you feel like you just can't rebound from it, some kind of pelvic surgery, endometriosis, other reasons. You're having bowel issues, whether that's constipation or leakage. You could be having sexual pain or just lack of sensation. So pretty much if it's from here to here, it can be pelvic floor related. Also, as a regular PT, what I noticed is that we were bringing people to almost better. If they had a lumbar problem, they had a hip problem, we're like, "Yeah, it's mostly better. I don't just go work on that," because you didn't know what else to do, because you tried everything else. And then we realized, oh, guess what? There's a pelvic floor component that we just weren't taught in school, and we're not taught as PTs. So that was just very interesting to me, that we could solve some other problems. So what I was thinking today is to just do the basic of what is a pelvic floor, because it's getting a lot more hype in the media. You're probably, if you're on social media, you're seeing it a lot more. It's, definitely more, okay to talk about. Men are realizing that you have pelvic floors. Guess what? You have all the same thing, and they usually don't seek help as much unless there's a prostate problem, something like that. Um, so it's just lovely to see people are talking about it. It's out there. Now, the problem with that is there's a lot of misnomers with that. There's a lot of, oh, Kegel, 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 Kegel. And you're like, oh, maybe not Kegel, so there's a lot of misinformation. So that's one of my things I wanted to clear up to you about what is a Kegel, if you heard of it, and what does that mean about the pelvic floor. So, two basics, and I forgot my whiteboard. I'm so sad, but I did get a piece of paper and a marker, so we'll do it old school. And I'm trying to keep, really aware of time, too, because I tend to this is a passionate project for me, so then I get excited. But so basics. Here we are. Here's your pelvic girdle. Now you have 8 main muscles down there that make up what's called the pelvic floor. And pelvic floor is a region. It's not just a muscle. So when you hear pelvic floor, it's like a grouping of muscles. And people call it, oh, is that your Kegel? Well, Kegel is actually a contraction of the pelvic floor. So it's all those muscles working as a team to lift up and in. So it's their way to contract. So if you take this bowl of pelvic floor muscles, a Kegling is one thing it does, but the reason why it's so important is it really beyond just a Kegel is its whole job function is to be a load bearer. So it is at the bottom part of your core. And we always hear about cores. We hear about the stomach, we hear about the back, but there's a diaphragm and there's a pelvic floor. So it's a closed system and they're all 4 very important. And we used to only think it was about stomachs, but it's so beyond that. So our key is like, well, okay, as a floor, what do you do? Well, its job is to hold up all your organs, all your pee, all your poo, a baby if you're pregnant. It's supposed to be able to be strong enough to do that depending on the weight of the day. It's like I said, a load bearer. I call it the donkey of the body because you just throw things at it and you take things off, and you put things on, and you take things off all day long. So if you bend over, if you lift a heavy laundry basket, if you're getting groceries from Sam's Club, you're changing what it's doing the entire day. So it's constantly a juggler of weight in your body. And that's really important to know because it has to be strong enough to do that, but then also flexible enough to let out pee, let out poo, let in penises, just relax and not overwork. So by far, most pelvic floors that you hear about, if you're having any kind of problem, are almost always too tight, not too weak. So we're gonna talk a little bit about that later, how to even figure that out. Because there is a point where if it's being misused or being overused, then you're gonna have those symptoms that I was starting to mention. All the urinary, all the bowel, all the sexual symptoms. So that being said, it also has some helpers, so it doesn't stand alone. But you guys are okay? Okay, so it has all those muscles to use, but it also has some 3 main muscles. One of them is a transverse abdominis. It's a very deep core muscle for your stomach. It has a glute medius, which is a hidden butt muscle, and it has multifidus, which is a back muscle. And those are the 3 main helpers of your pelvic floor. So sometimes if it's dysfunctional for whatever reason, it's sometimes because those guys aren't helping out like they should for whatever reason, and it's doing a lot of the work itself. So we, as a pelvic floor physical therapist, I would look at all those entities. So I'm going to stop you right there. Is that any questions so far?
I have a question.
Sure.
So when it comes to a dysfunction, can you test for which layer of the synergistic muscle groups is not showing up enough?
Yes.
Okay.
Yeah. So what would happen is if you're having any symptom that's bothering you from here to here, you would come in and then we would do an internal, and that was the best way to check. Now it's easier for women because we have a vagina, a lot easier. It would be a rectal test for men, but there's so much to do outside of internals. I do a lot of muscle testing. We do a lot of pattern testing and your muscle movements to see what's lacking, what's not, what's helping out, what's not working. Did that answer your question?
Yeah.
Yeah,
Yeah,
so yeah, a lot of,
because that's like when we're helping a client become stable, we have to kind of essentially look and see if it's coming from their back, it's coming from their hip, is it, you know, kind of those things. So.
and they can mimic each other. There's a lot of compensation in your body because it's not dumb. So like, for example, the glute medius is almost always weak if you're having a pelvic floor problem because it just lets the glute max do everything, or the hamstrings. It's like, yeah, go ahead, you're already doing it. Why am I helping? You know, or the transverse abdominis, which we're going to talk about in a minute, is a very deep core abdominal muscle. It's not the, you know, the glory of the six pack or the obliques. So it'll just kind of go dormant, not dormant, but it's just like, oh, why am I working so hard? You guys are all doing your thing. So we're trying to pull those in because the pelvic floor wants a helper. And so, and then if you're healthy, great, you might not have any of those issues, or you might have twinges of them. And then what you're trying to do is avoid problems in the future of just by being aware. So my big passion is, are you aware of your pelvic floor? Can you be aware of it? Just so you know if it's healthy or not. Or if there is a problem in the future, you can go seek help quicker, but before it is a future bigger problem. And so that's what I would like to talk to you about today. So my first exercise for you is just pelvic floor awareness. So I know you guys are really, that's why I'm so passionate about this exercise studio, because you guys bring awareness to all these different muscles. You already talked about that core already.
You're just gonna have to take class with us. So
I know, I will. I will. I love it. Okay, because you're already passionate about that too. Okay, so my suggestion is go ahead and lay back or get comfortable sitting, whatever you want to do. And I'm going to walk you through just a mini body scan. Okay, so if you're, and it doesn't matter what position you're in, whatever makes you happy. Here, oh, here's a.
No, I'm just, hey, is Friday evening. I am absolutely down on the floor.
Okay. All right. So this is just like kind of a mini awareness of your body and what you're feeling. Okay. So right now, if you just close your eyes and we're thinking about what's happening in your body in the room. So we're thinking about environment first. So right now, you're imagining, am I comfortable? Am I balanced? Probably you're laying down. Do I want to wiggle or can I relax in this position? Am I cold? Do I feel a breeze? Is my nose stuffy? My back hurt? Can I fully relax? Do I hear any sounds? And then I want you thinking about your actual body, and we're going to scan down. You're thinking, can I feel my scalp? Can I actually relax my eyes so they're not wiggling all over the place? Can I relax my jaw so it's not taut? Can I do a nice good inhale through my nose? Can I exhale through my mouth? Are my teeth together? Are they closed? Am I holding any tone in my shoulders? Can I relax my fingers and my hands? Is my belly rumbling? Am I hungry? Am I clenching my butt at all? Can I let it go if I am? Are my thighs relaxed? Block my knees open. Are my feet clenched? My toes curled? Can I relax them? And then I want you to go back up to your abdominal region. There's a lot going on. In my belly, can I feel the difference of where I imagine my stomach is versus where my ovaries are? Can I feel what would be a bowel? Can I feel my bowels versus my tummy? Can I feel my breath in my belly? And then we're going to think about that pelvic floor. There's a layer of those muscles right under my skin that stretch from my pubic bone to my tailbone, from my sits bone to my sits bone. There's a whole bowl of muscles there. Can I differentiate those from my stomach, from my bladder, from my bowels. There's a lot going on. Okay, now I would like you to sit up in the most comfortable position you have, whether that's cross legs or whatever. And I want you to cross your legs. Or whatever, sorry, anything that's good for you. And I just, not the whole scan, but if you could just close your eyes for a minute and think about some of the same regions. Can I feel back to the abdominal region? Can I feel where I'm balanced on my sit bone? Can I imagine that I feel where my pelvic floor is, all those muscles? Can I say, oh yeah, I feel those versus what would be my tummy? I can feel my rectum versus where my urethra, like I can tell those differences of where I'm sitting, even if I rock back and forth. What are they doing? And that check-in is so important to start gaining awareness. We don't have, as Americans particularly, any great awareness of our pelvic floor region. Everything's grouped together in our belly. So I want you just to, one of the take homes is to start thinking like, yeah, I do kind of start differentiating this difference, because it's going to make a big difference in how you exercise and how you're going to pull that into your exercise. So with that being said, can you Kegel? Do people understand what a Kegel is? I'm going to talk you through it to make sure, okay? All right, so if you were Kegling in this position, one of the ways you would feel it would be if you are pulling your vagina, and we're gonna since we have a nice gentleman in this group, there's one thing we say with men, excuse the crashness, but it's nuts to guts, right? So you're pulling your nuts up into your guts, right? I hope you don't mind I single you out.
That's exactly what it feels like.
Right? Okay. And for women, can you pick up a blueberry with your vagina? Now, if you picked up an apple, it wouldn't be very good because it'd be like this. Right? I want you to do a blueberry, that dexterity right there. Another way to describe it is if you had a straw, could you suck up a milkshake? Not just water, water's too fast, right? You suck up a milkshake up and in, right? And can you hold the milkshake? Can you let the milkshake go? And so for pelvic floor, it is just 100% as important to have a relaxed pelvic floor and be aware of it as to have a strong pelvic floor. So another analogy I like to use for pelvic floor is shoulders. So you have muscles in your body, and you can relax, do whatever you need to do, guys. I just want you to kind of clean that up. So in your body, you have postural muscles that always hold a little tone. Okay, if your elbow is floppy, it doesn't matter. I mean, it matters if you're trying to lift something, but otherwise, some muscles in your body just don't matter if they're holding tone at any one time. But there are other muscles that do. Jaws are one, or else we'd walk around like, we walk around with open jaws. Shoulders and paraspinals are some, because otherwise we'd be doing this all day long. Pelvic floors are some, or else our organs would flop and, we won't be able to hold up all our bow and the weight that changes throughout the day.
Wow.
So
Your images.
I'm sorry.
Very effective.
Okay, good. All right, good. So I'm a mom of 6 too. I didn't tell you that. So I throw all kinds of images out. Okay, so but if knowing that, those are the muscles that hold stress. So those are the muscles that you're going to clench, they're going to tighten, they'll ache and hurt, that you get knots in, and that this is a hidden stress. Because of all those postural muscles in that tone, we are apt to keep high tone in our pelvic floor. So if you ever notice that you're clenching your butt, you're clenching your shoulders, I almost guarantee you're clenching your pelvic floor. And that's important because that will end up causing problems. That's only can compensate for so long. That donkey can only hold things be a beast of burden for a while, and then it's just something's going to break eventually. That's why it's so important to get that awareness of the relaxation as well as the strength. So back to the shoulders for analogy, if you're looking at shoulders Shoulders that are high tone, this is not strong. This is not effective. This is tight. This can't work for you, right? All right. This is effective. It can lift when it's want to. It can relax when it needs to. Also, floppy muscles aren't good either. So if you have a pelvic floor and it tends to be too tight or too weak, those both are not strong. I mean, I'm sorry, too tone or too floppy, atrophied. Neither one are effective. So our goal, is how can I be aware to keep my pelvic floor just like this? Okay, so I'm going to pass out a noodle. And I know you guys have done certain things like this with balls and things, but I like my noodles. And I'll show you why in a second. Oh, I have actually another sheet to put you too. These are yours to keep. Nobody wants them back. There you go. Okay, so I want you to layer. I want you to sit on that noodle, okay? Right? No, I want you to straight in the middle, right down the middle, and whatever you can do to get. Now, if it's really uncomfortable, you through any reason, you can shift it aside because I want to show you that as well too. But if you can tolerate it in the middle, how's it doing? You can sit any way you want. You can sit cross-legged.
A blueberry.
Yeah, I know, right? Okay, now what?
Than an apple.
So what this does is it's going to give you some proprioception to your pelvic floor. So right now, thinking that you're picking up a blueberry, you're going to pull up and try to squeeze that pool noodle. You're going to feel a squeeze against it, like you're picking up the pool noodle a little. And I know it's more like an apple, but use it. Now, if you relax all that, you're going to feel it almost flour and soften down around that pool noodle if you do it right. Now, a lot of people feel like they're kegling, they're not. So, or they're using their butt cheeks. I'm not seeing any of that going on. You're not using any of your other muscles to make that kegel happen. No one should be able to see this. You're sitting in, in a meeting, you could kegel away and no one should see that. Now, it feels like sometimes they can, because if you notice these pelvic floor regions, especially around your anus, there's a lot of muscles going on. So what's crazy cool is you can start a contraction from the front of your kegels or the back of your kegels. So what you're doing is you could imagine squeezing near where your pee comes out, like you're stopping pee, or you can imagine towards the back where you're holding in a fart. Or the British say passing wind. Don't pass wind. Can you hold in your wind? Okay, so you can imagine that pool noodle kind of gives you awareness, like, okay, I can squeeze from the front, I can squeeze from the middle, or I can initiate from the back. They're all going to pull in. So a lot of people think they're doing Kegels wrong because they're like, oh, I'm squeezing my bum. You're not squeezing your glutes. You're squeezing your pelvic floor. As you can see, they're pretty wide region to these. You're going to feel it right here a lot, but they're hidden a lot. So now the most important thing is, can I release them around that pool noodle? Okay, now if that's getting uncomfortable, actually, if it is, I want you to take it out. What we're going to do next is talk about diaphragmatic breathing. Okay, before I go on though, any questions about all that?
Three-dimensionalness of the very.
Which part, the pool noodle?
Yeah, I mean, just the whole, yeah.
Yeah, right.
It wasn't a
Yeah.
question, it was just a.
So when you're doing a contraction, there's an up and in. It truly comes up and in as a team. And then if you're relaxing, it just settles out. So it's going to feel like this. It's going to feel like that. Okay. Now, that being said, and knowing that a relaxed pelvic floor is actually way more important than a strong pelvic floor, in theory, because we can't be walking around like this inside, right? It causes all kinds of problems. So what we're going to do is, like, what's the number one way to achieve that? The number one way to achieve that is awareness that you even have that area. So that's what we're working on. Is something tight? Am I holding it in? Can I relax it to neutral? Can I imagine it spreading across that pool noodle? So the mechanical way to do that is through diaphragmatic breathing. So that's when I use my whiteboard, but I'm going to use my. So I always like to draw this picture. So this, and I'm not a good drawer, okay? This is your trunk. This is your belly button. Can you guys see?
Mhm.
Okay, you have a set of lungs up here. And then you have a big flat muscle right here. That's your diaphragm. Top of your core. It's a very huge flat muscle. We as a, now you guys are probably steps above all my patients, but we don't use our diaphragm the way what we need to. It takes a lot of mindfulness to start realizing how to truly do a belly breath correctly. You probably already ahead of all of us, but that's great because I'm probably preaching to the choir right now. But pretend you're not. Pretend you don't have anything. Okay, so then here is your pelvic floor. So there's that grouping of muscles right here. Okay. Now, let's assume you have a tight pelvic floor. Okay, just to teach for this, because this is when diaphragmatic breathing is really important. If you have this problem, that would mean that your pelvic floor is kind of hanging out up here. Not quite that dramatic, but you get the sense what I'm talking about. Now, if you had a relaxed pelvic floor, it could come up to that level with the Kegel, or it can relax back down to normal. And actually, there's a reverse Kegel that we'll get into some other time. But there's some other lengthening you could do to the pelvic floor as well. But for right now, for our purposes today, we're saying if you're holding any tone in it, or during the day, it gets to be where it's up here, just from stress, from everything, from clenching, from if you feel achy in your pelvic region and you're like, I just don't feel good. It may be a clenched pelvic floor. That's where we hold that tone because of the reasons I told you. Okay, so what do we do about that? Well, we can try to be aware and relax, but mechanically we can do some deep breathing. So what happens with a belly breath or diaphragmatic breathing is you actively lengthen your pelvic floor where it lowers down. What that means is you can take a breath in with your chest without as much movement because it just made room for the expansion of your lungs without motion. If I told most people right now to take a deep breath, they would do this.
Right.
So take a deep breath and pretend you don't know what to do. So take a deep breath. That's what we do. We use our shoulders, we use our chest. We are not using our diaphragm. It's very lazy in general as your typical American. Okay, so our goal is like one, it's just good practice to learn this diaphragmatic breathing. Two, it really helps you relax your pelvic floor. Now, what that does is this is a closed system. So your core is closed. So if it's up here, this is where it's hanging out. It's not going past this circle. But if you drop your diaphragm, then what you can do is that pelvic floor, if you take a deep enough breath, the inter-abdominal pressure will naturally mechanically push down your pelvic floor. So that's why this works for your pelvic floor. We're creating enough pressure from your diaphragm to push the tissues out all the way down. So,
Can I ask you a quick question?
yeah,
So
please.
visually, your diaphragm and your pelvic floor are mimicking one another.
Yes,
They're not opposite.
yes.
Right, okay.
It doesn't always feel that way.
Yeah.
While you're doing it inside, you're like, what's happening? But that's mechanically what's happening. It's creating enough pressure to push that down and out. And not really down out your body. It's just pushing it out enough so it gets out of this state. So it gets into this state mechanically. That's why it works. So I like to use a balloon, for example, for that. So here's your insides, right? This is quite the perfect example. But right here, this would be your chest. So when you take a deep breath that we're going to practice in a second, this part of your chest isn't moving. So if you have one hand on your chest, one on your belly, and you take a breath in through your nose, this hand should not move.
At all?
You can keep it totally still and just let the air bypass that and go to your belly if you can drop your diaphragm down strong enough. So it would look like this. You're imagining this inside. You're imagining everything below nipple line kind of expanding out. This is also called 360 breathing. It's called 360 because if you do it right, you're going to feel a slight flare of your ribs. You're going to feel it on your back if you're against a mat. Your belly's going to expand. And if you don't guard your pelvic floor, this is a guarded pelvic floor. This is a relaxed pelvic floor. You can guard against it. You can guard it against anything. But you're in your mind's eye, you're going to let that air go all the way down past your tailbone into your pelvic floor. And this actually takes a lot of practice. So if you do this correctly for a pelvic floor relaxation technique, you're gonna feel softening at your perineum. You're gonna feel expansion at your belly, lower ribs, into your perineum where you're going to feel it's going to feel just like a softening is the best example. A slight expansion. So we're going to practice this. So I want you to go ahead and lay back again. Get really comfortable.
Can I ask?
Sure.
If you have a prolapsed vagina, if
Yes.
you have had 2 or 3 kids,
Yeah.
if you have had things descending on you, aren't you supposed to be guarding that? Because if you push the other way, all that stuff's gonna go down and out.
You are correct, and that would make sense. However, we still need a relaxed pelvic floor. So one step beyond that is, okay, now that you're relaxed, because remember, now that you're relaxed, how can we get you to be strong? We don't want you doing this because that's where your organs. We need you back here but if you guard too much, then it's never going to be effective to strengthen it to combat the prolapse. So it's still, you're right, it almost seems like
It's almost
anti-productive.
counterintuitive.
But we're not pushing down and out. So if you had a prolapse, I would never tell you to do a reverse Kegel.
Yeah.
If you have a tight pelvic floor, you would absolutely do some reverse Kegel. That's why you need that internal check. Okay. Does that make sense? Okay, so go ahead and lay back and get really relaxed. And then put one hand on your chest and one on your belly. Okay, so you're gonna breathe in through your nose. You're gonna try very hard not to let your chest rise. You're gonna send that air straight down to your tailbone. You're gonna try a few breaths this way. Just play around with that. Now, what you're imagining is that expansion. You're going to feel the intake of your air through your nose, out through your mouth. So in through your nose is a slower, deeper inhalation process. So that just allows that to program it right where we want it to go. And then what we're going to do is you're going to feel that slow. I want you to breathe out slightly longer than you're breathing in. Okay, so you're going to breathe in through your nose, let's say for 6 seconds. I'm going to count you through it. Ready? We're going to breathe in through your nose, no chest. 2, 3, 4, 5, 6. Now out through your mouth. 2, 3, 4, 5, 6, 7, 8. Exhaust all the air. Now, when you're breathing in through your nose, to strengthen your diaphragm, it's going to almost feel like you hit a wall. Like I can't breathe anymore in through my nose. This is all I can do. But then you can, and you're going to breathe in one more half second deeper. Because our goal here is to strengthen your diaphragm. So we're breathing a little deeper than you think you can. We're not pulling in your shoulders, your chest. We're not letting anything help it out. We're just thinking about your diaphragm and your belly expanding. Like I said, it feels like I can't do it. And then you say, yes, you can. We're strengthening a muscle that is really weak. And then when you exhaust your air through your mouth, some people find it's helpful to make like a straw breath, like you're pushing out air through a straw. So purse lips, and you're going to breathe out every single drop of air in there. You're going to breathe out more than you think you can. Now, if you're comfortable, a good position to try this in for your pelvic floor is like a happy baby or a butterfly. Anything when your knees are spread apart and externally rotated. So if you're comfortable, try just a butterfly, or what they call it sometimes bound angel. Happy baby's a great one. And then if you can relax enough in your home, put some pillows under your knees if it's a problem. Our goal is not to create any stretching of your adductors, or we're really just trying to see, can I relax my pelvic floor? So you might put like a bolster under your knees, do modified happy baby. But if you do it in this position, you will be more apt to feel that slight movement of your perineum when you get to the very, very end range of that inhale. And then you just let it all go. We're not pushing anything out, just letting it expand naturally on the inhale. That very end of the inhale is usually when I start feeling the pelvic floor relax. All right, give me some questions. Anybody feeling this in their perineum, in their pelvic floor?
I feel some cramping in my diaphragm.
Okay, yeah, that too. It's weak and it's not used to this. What do you think?
I'm not sure.
So I like a modified happy baby like this. I can't do happy baby because I'm old. Okay, here we go.
Cause you're all.
I'm only 58, but I feel old. Okay. So I like to do it that way.
Okay.
Because I can relax better. You look like you're a pretty good happy baby yourself. And then if you have hip hop abductors, you would be putting pillows over here at home, right?
Right.
You can really, if you're just stretching, that's not going to help you relax.
No, I will partially believe it. I don't have any problem with chest.
Okay.
But my back does expand.
Okay.
when I-
Okay.
Are you asking me to hold that too?
No.
Okay.
Let that go.
Actually, it won't work.
I know
There
it's
was a
no.
time that my upper back was like.
No, let that go.
massive. It-
No, I'm glad you got it moving, and so just really let that go. Just
All right.
let that really expand. And is that a bolster over there? You saying?
Oh,
Oh, here, this
I can
is.
use it like one, yeah.
You might do something like this. So, and then you would let your knees fall open a little bit. Just so your pelvic floor, if it's legs closed, it looks like this. It's closed. But you do this position, it just gives it enough room for where you can feel that expansion in your brain a little bit. You're gonna feel this. Now people take weeks. So for example, I was a physical therapist and they kept telling me to do the diaphragmatic breathing. I didn't really get any great tips. It took me 2 weeks to learn this. And I remember laying in my living room exactly where I was at. I just kind of exasperated. I finally took this big breath in, and all of a sudden I felt the movement in my perineum. Like I felt it expand just, slightly. And I was like, oh, that's what they're talking about. Like it was 2 weeks later, right? And I was like, oh, and then I practiced a little bit more. I was like, because I could kind of get it then. And then I thought, oh, it feels like I'm breathing through my vagina. I'm like, oh, we darn. So then I finally got it. And then you can pick it up because we have muscle memory. We have so much bad muscle memory. It's crazy. It's like trying to, it's like trying to unlearn riding a bike or like take skiing. Like you learn how to ski, you're great at skiing, you realize, no, I'm not quite as good as I want to be. I want to go take lessons. And then to unlearn some of your bad habits, unless you're an instructor, it's like, you're just automatically going to go their way. So this takes practice. I really would, you guys go home and just really start thinking. But if you feel this in your perineum and you're feeling that slight gentle movement down there on the very end of the inhale, then you're doing it right.
At the end of the inhale?
At the end of the inhale. So you
Okay.
take a deep breath and let's say you take 6 seconds in. And that 5th or 6th second is usually more where you feel that gentle movement.
Now, if you have problems making your exhalation longer than your inhalation, I always think when I'm in yoga.
Yeah.
My lungs have to be smaller than everybody else's because I cannot keep exhaling.
But it's more
So
about
is
that.
that something that you have to just work?
Yeah, and it's the
You
rate
have
of
to ration your I'm like
yeah, right. No, you might be. You're wringing out all the air,
Yeah,
right? And it's just a lot of it's based on the rate of inhalation versus exhalation. I mean, you're breathing in the same air. It's just more of out through your mouth the versus into your air and how it's being absorbed and the rate it's going out. Mostly we want to do it because of the next step I'm going to show you. Is I really want you to set your TA when you're doing this breath. Okay. So before we go on, what do you guys think?
Yeah. So my question is that doesn't feel like it works so good to try to do it without all the other muscles.
What do you mean?
I feel like I can only get like the way you're coaching us through
Mhm.
like the full systematic. I don't feel like I have the strength individually.
You're trying to pull on your shoulder. What muscles do you feel like pulling in?
I need to use my like I need to use my transversus. I need to like get my diaphragm. Like if I can get my diaphragm to go first,
Mm-hmm.
then I can basically like sense and feel, but I cannot do it without.
You're gonna practice that. It takes like remember you go say hear people practicing yoga for years. Like this takes practice. It really does. And you might be getting the benefit even without that. And that's something you wouldn't be able to tell without an internal. but it's still good practice. If you're feeling your perineum move, then you're accomplishing the goal. Are you feeling any soft movement there?
Yeah, I just feel like I feel like I'm more, I don't feel like I'm on the other side of the spectrum where I'm too low, not responsive enough.
You may be, and you're pulling all that just to make it happen. Yeah. So, and this
Like
is,
it's a lot of work to get there, and then I get there, and it took me like forever.
but then with the muscle memory, you're going to go there quicker. You practice, and then so another favorite analogy is this. I love this analogy. Is if you're walking through a forest and you see a meadow, and there's a lake beyond you, and you're like, I'd like to visit that lake, but there's no path through the meadow. You're like, oh gosh. And so you're like, well, I'll just make a path, and you make it through and it's safe. And you look back and you're like, oh, I could kind of see where I walk. There's some few grass bent down. And then you follow that path every day, but you follow it 3 times a day. Pretty soon you're going to have a dirt path from the forest to the meadow. And that's like your brain to your pelvic floor. There's just a lot of other stuff going on. And we don't, as Americans, have very good pathways to our pelvic floor. The more you practice, especially this breath in particular, the more that you're going to get there. Now, I wish there was a lawnmower. We could just, that would be so handy. I'd be sitting on a beach somewhere right now. But there's not. So all it takes is repetition, repetition, repetition.
I'm curious about what everybody else in the world except Americans are doing.
I keep saying Americans,
Yeah.
but it's true though. I only know Americans, but there are other. If you read some other countries and they're more focused on yoga and breath work and mindfulness, they don't have as much pelvic floor
Okay.
problems. It's just crazy.
I just
Right?
read that about
Yeah.
France. It's
Right.
mandatory after, not
Yes.
mandatory, but after childbirth.
Yes.
They have to learn about.
Yes, there are other countries that it is standard care pre and post pregnancy to go get pelvic floor. Because they don't, and is it socialized medicine?
I don't know, I'm not sure.
It's a government health system.
Yeah,
Yeah.
so I mean, they don't want the later problems. They don't want to pay for things
You
later.
can get private too,
Yeah,
but
yeah, let's avoid some of that healthcare cost. No,
That
it's not
is
because
so
there's a problem.
interesting that they're like going to invest in prevention because it's too costly later.
I know, it's so,
Unless they're gonna sell you something like they do here.
right,
Yeah,
right.
okay.
We're all about fixing problems. Let's not prevent them. Right? So, like I said, most people though suffer from high tone more than low tone. So if you're Kegling and you feel like you can't get to that relaxed state or you can't do that diaphragmatic breathe, now then that would mean like, oh yeah, I probably might have a high tone pelvic floor. And so you're just going to do a lot of breathing. You're going to create that pathway from the forest to the meadow. And then you're going to be standing at the giant eagle line and you're going to be in the wrong line. And you're going to be like, always the wrong line. But then you're like, you know what? No, I want to practice my breathing because you're going to practice it standing and no one can tell. And then you just relax your pelvic floor and didn't get in a tither. And relaxed pelvic floor does not mean a weak prolapsed pelvic floor. It just means a relaxed pelvic floor. It is, and all that prolapsing is going on up here. So you're also going to be able to utilize it because it activates your vagus nerve. So this is another bonus to the diaphragmatic breath. You are activating a nerve that's parasympathetic. It is the opposite of your sympathetic.
Let me step out of this.
So when you're doing a diaphragmatic breath like this, there's absolutely no way that you can fight a bear or fight a fire. You can't run across traffic and save a child. You just can't do it while you're diaphragmatic breathing. This is when you do that kind of thing, right? So it's the opposite. And so it's a tool, not just to relax your pelvic floor and avoid problems. It's also a tool to say, I'm really stressed out. My boss is killing me. Let me do 3 of these breaths. And then there's this side bonus of relax your pelvic floor at the same time. So now I want you to sit back on your pool noodle. And we're going to practice this, not just an inhale and relax your pelvic floor. I want you to do 2 things. I want you to do a Kegel again. Pull it up and in away from that noodle. You're going to bring it back to neutral over that noodle. And then I want you to do a diaphragmatic breath. If you do it right, you're going to feel a little downward pressure, not just relax into the noodle, but a little downward pressure into the noodle. Just a little, and then bring it back. On the exhale, So now we're gonna, is everybody okay if I move forward with this? Okay, so now we're gonna practice. I take the needle away because there's just like too much noodling. Okay. Alright, so now with the pelvic floor, now that we know we have a relaxed pelvic floor, what we're gonna do is talk about the helper muscle, which is transverse abdominis. So that's that deep core muscle. So this is like putting a girdle on in your inside. If you're transverse abdominis, your likelihood of blowing out your back is so much less. I call it the Scarlett O'Hara of the corset world. Remember when Scarlett O'Hara's getting her corset in and Mammy's like going, so she's pulling that in, and that's what it's doing to protect all that, because it wraps all the way around. So when you contract your TA, you're going to feel it in your pelvic floor a little probably. So what you're going to do right there is you're going to take your belly button like you're sucking it into your spine. Now, we're only isolating your transverse abdominis. This is a very, very tight muscle. If you feel like you're putting on like a tight pair of jeans, feeling that getting really tight.
Are we going up a little bit?
It could feel like a little up, but you're thinking belly button to spine.
Okay.
If you're in a Zoom call, no one could see you doing this. You could be able to talk while you're doing this. So let's try, be on the Zoom, make a Zoom call with your hands, everybody. Now, no movement. We're not doing this to make your transverse. We're not scooping we're not pelvic tilting. You're pulling your belly button to spine. And let's try that like 10 times. Now, when you're doing that, you might feel your pelvic floor flicker up. Anybody feeling pelvic floor?
I am.
Yeah, because that's your big sister's pelvic floor, big brother to your pelvic floor. Now, can you try to set your TA without your pelvic floor? If you can't, it may be a higher tone pelvic floor. You kind of keep your pelvic floor out of it. Now you could do the reverse, do a Kegel without your TA. So pull in your Kegel and let your transverse abdominis. It's called a TA. Relax your TA. And now only do a Kegel without your TA. So you should be able to do both apart and then together.
They wanna work together.
I know, and they usually are a team, and that's okay for now. So you're pulling that up and in. Now, people will use this muscle to protect themselves when they're lifting. So I want you to start thinking in just life without your pelvic floor. I want you to set your TA before you go pull that case of water out from the Sam's Club. You're gonna set your TA before you get that load of laundry. You're gonna set your TA if you're struggling in the attic to get something out. This is your girdle protector, and it will probably pull in your pelvic floor with it. So we're gonna use that in a second too.
I think one is a little easier than the other.
Which one?
So I can isolate the pelvic floor easier than you can isolate
Really?
TA.
Okay.
But I think that might be in part my Pilates, because one of the first things you work on for start is learning what the TA is and
Yeah.
where, how to
If you're a
activate
good
it, how to
Pilates
use it.
instructor.
And you're not necessarily taught to separate that from floor.
Yeah,
But-
it's literally lesson number one.
Yeah, it
Yeah.
is.
But I think, maybe that's something you should think about. Maybe, so everything kind of works together. You learn to do that kind of all together because you're protecting your core and your
Yeah.
back.
Yeah.
And maybe people should also be kind of taught to work on the TA without involving the pelvic floor if they can.
And usually functionally, they work as a
separately.
team.
Yeah.
The only reason why we would care is if you have a spastic pelvic floor, we're trying to figure out how to disassociate that.
What does that mean? Does that mean irregularly spastic is irregularly?
It just means like high tone where it might. So like a lot of times if you have urine leakage, a lot of it is a little muscle spasm that's happening and it's squirting out that leakage. It just wants to help and it's just going into high tone, extra high tone, and it ends up leaking urine is one of the reasons. You can leak urine from a weak pelvic floor because it's just not strong enough to work, or a high tone pelvic floor. So a lot of the symptoms you get could be either. So if you were sitting there again and you were trying to work on your TA to strengthen it, one of the ways to do is on the exhale. So you would take a nice good diaphragmatic breath in and really fill your belly. And then on the exhale, you would do what I call the zip up. You're zipping up the tightest corset you can imagine. So you're zipping your Kegels and your TA and you're pushing all the air out that way. So we just added the TA and the Kegel to that exhale now. And you might have been using a little already. So go ahead and lay back down again. And this time bend both knees. And then put one hand on your chest and your belly just for awareness and you're gonna go ahead and do a really nice, good deep breath in. Get that belly breath going. And you're gonna count to 6. And then on the exhale, halfway through, start zipping up, pulling the Kegel, pulling your TA, and suck it almost like you're pulling it up under your ribs. But you're not tilting your pelvis, you're not squeezing your butt, you're not doing anything else except isolating your TA and your Kegel, trying to push out all your air. And then relax from that. Just take a break. Woo. And this is a great way to strengthen that and create awareness for that. So you're going to breathe in through your nose again. Breathe in through nose 2, 3, 4, 5, 6. On the exhale through your pursed lips, you're going to go and exhale out. About right now, you're going to start pulling in your Kegel, pulling your TA, zip it up, tightest corset ever, and push out every single drop of air. And then take a breath from that. You're going to feel that around your back if you're going tight enough. So practice that a couple times.
I think that approach helps you get a little more air out.
Yes, it does. Yeah. You're using those accessory muscles to help you out.
Okay. All right, is there anything under the sink or no? Okay. All right. Okay, honey. All right, I'll stop the camera.
How's everybody doing?
Okay. I got you.
Now, pelvic floor and transverse abdominis
You're welcome.
work whether you're laying down or sitting up. So go ahead and have a seat and sit on that pool noodle again.
Wow. It's pelvic floor. Then down our pelvic floor session.
And then what we're gonna do, don't mind,
Very interesting.
and this is too uncomfortable, just
Yeah,
skip that
awesome.
part. A lot of people use like a rolled washcloth. It's not as tense as a pool noodle. Whatever works for you. Okay, so you're gonna breathe in, one hand here, one hand here. We're gonna breathe in through your nose. If you do it right at the very end of the inhale, you're gonna feel that softening around the pool noodle. And then you're gonna breathe out. And halfway in, you're gonna pull your Kegel and your TN, and you're gonna pull up and away from that pool noodle. And then you're gonna go to neutral again. So this is a great tool to just check in with your pelvic floor. Can I relax enough to feel that movement? Can I strengthen it and pull it in with that exhale and set my TA to feel that Kegel in with that? So we're relaxing and we're contracting on the same breath work. You guys look like you're doing all right. Most people are do what you are not doing, which is a lot of butt clenching, a lot of pelvic tilting, a lot of shoulder lifting. Just trying to compensate to make this work. But you guys all look really great.
You feel the breath going into your
should.
back.
You should.
Yeah.
Yeah. And that's why it's called 360. Yeah.
I think that's because they're just trying to figure out what to do.
Yeah,
They're
it's
not- They
true.
don't have the awareness to say, okay, I do this and I do that.
No, they don't. It's all like a blur.
I've been there before.
But you're not anymore,
No.
which I love. Yeah. And there you can teach other people. Okay, so how often would you practice? I would practice this every day. Like 5 minutes here, 5 minutes there, because you're going to utilize it. You're going to use a line with that vagus nerve, so that when you're talking to the boss or your kid's driving you nuts or whatever's happening, you can say, wait a second, let me do a diaphragmatic breath here. So I don't want my pelvic floor to be in a twist. I want it to be nice and relaxed, and I want to activate this parasympathetic nervous system.
You could actually even use it as a way for relaxing if you're tense. right?
Yes.
Breathing is good for that.
Absolutely.
Okay, well, practice my
So
breathing
2 for 1.
exercises and maybe calm down.
Yeah, 2 for 1. You know, so when they take that deep breath, we're taking it to that next level for your pelvic floor. Now, does anybody ever cough and sneeze and pee? Okay, every time. Okay, so we're gonna try to do something to avoid that, okay?
Mine,
I sneeze a lot too.
mine, if I have a cold virus,
Mm.
if I have if I cannot be in a cold, I can be like starting a cold virus or something. And it's like my system switches over and I don't have the same functionality. I do notice that, like if I have a cold virus, it's like my rewiring is off or something.
Yeah, it is, right? Like, all your body
Yeah,
fighting
But
things.
that's like new recent. It's like in the past 2 years though.
Well, you're getting old, Leslie. I'm just messing with you. All right, so there's something called the knack. There's something called the knack. Okay, and some Australian lady made it up, and it doesn't stand for anything. No acronym for anything. It's just you have the knack of doing this. So what you're going to do is every time you do a cold, you're going to use this TA and Kegel to help you from leaking urine. So without sitting regular, whatever you're comfortable, I want you to not do anything with your Kegel and pelvic floor. I just want you to pay attention to it. And I want you to give a big cough. Do you feel any coughing out?
Yeah. Nope.
No, you don't? You do?
No.
Well,
Do you feel coughing out?
I purposely squeeze when.
Okay, well, come
I
on.
sneeze.
So okay, so relax. Have you ever seen all the women like, or whoever crossing their legs trying not to pee? Yeah,
Oh yeah.
yeah. So sometimes the reason why that works is you're actually activate. It's not going to hold any pee, and it's your urethra. You're not going to squeeze your urethra. But what it does is sometimes activate your pelvic floor to create a response to help you stop from peeing. But we're going to do it actively. So right now, can you try not to squeeze? And can you give a good cough? And feel it pop out. I know. Sorry if you're going to leak. But like, just try it out.
We have stuff to clean up.
Yeah. Yeah. Now, Michael, did you feel it too? Could you feel that outward pressure when you talk?
Yeah.
Okay, so,
Yeah, so yeah.
all right. So now you have these tools. What I want you to do is pull in your Kegel and your TA. You don't have to hold, don't worry about your breath. Just pull it in, hold it, and give a cough. If it's strong enough, you're gonna practice this. You will feel a little pressure because it's just creating an interabdominal pressure to cough or sneeze. So you're gonna feel a little bounce, but you're not gonna feel the blowout that you just did. So I want you to practice again. Relax everything, cough. You don't feel the pull out? You don't feel the blowout?
I feel
You feel it there?
up here, yeah.
Nothing on pelvic floor? Now, hold your TA and Kegel though, pull it in and cough. Is there any difference? No, not too much, what you?
It's less. It's
So you might-
still trying to go out, but it's less.
So you might just have a lovely, healthy pelvic floor. That's wonderful. But it's a
What
good.
else?
But it's a good check it. And if you do leak, if you could just possibly remember to do that in that efficient way. I
Yeah.
think that zip up, right? Not just like, not
Yeah.
touching, like zip, 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 like I'm being,
Really like, just don't walk, don't move.
Yeah. Yeah.
So do you initiate from the pelvic floor and then get involved with TA, or is it together?
Leslie, the Zoom is muted.
Unmute. Okie dokes.
You're good now.
Yay.
Thank you.
Did you hear about the key and lock syndrome? You have to pee the second you get home.
Did not hear that part.
So a big phenomenon in the pelvic floor world is that you kind of have to pee. You're doing your errands. You're like, all right, I'm fine, I'm fine. And the second your hand hits the door, or the second the garage door goes up, you have to pee, and you have to pee now. It's called key and lock syndrome, and it's one of the signs of your pelvic floor is just just a dysfunction. It should not have to do that. So one way to combat that is just bladder training. So you would say, all right, I know you don't have to pee that bad. You talk to your bladder, you're sending neural pathways all the time. You talk to your body all the time. You're just gonna start talking to your bladder, right?
So rebellious.
And you're saying, no, I'm gonna wait 5 minutes. We're gonna unload the dishwasher first. We're gonna make that call I've been not wanting to make. We're going to, I don't know, let out the dog. We're gonna do whatever it is and not do that. So I call that brain over bladder. Because there's a brain bladder connection that's really, really strong. And our bladder is a very habitual creature. And not to offend anybody, but it's kind of like a dog. So if you teach a dog to sit, it might take you 100 times to teach to say sit, but on the 101, it gets it. And you're like, what took you so long? And then it takes that training. If you go pee that anytime you want, or anytime you feel that urgency, you've just kind of taught like a dog teaching it to eat at the table. And I don't know if you guys feed your dog at the table, but if you're trying not to, you never feed the dog at the table.
Right.
So you just taught it to beg you at the table. So it's kind of like training in some way, for your bladder.
It's stimulus response.
It is.
Can I ask, so when you're doing the Kegel, you're going up? And what is your anal area doing during this?
Okay, so that's another thing we're gonna talk about. Okay, so thank you. It is squeezing.
It is
You're
squeezing
gonna feel
also.
that. You're gonna
Yeah.
feel like, oh, I'm doing it wrong. I'm squeezing my butt muscle. But
Okay.
you aren't, because look at this guy. It is wrapping around your,
Yes,
all these
yes.
muscles are down here. That's called your puborectalis. It's
Right.
one of the stronger muscles down there. So what you can do is you can actually, here, this is kind of cool. Go ahead and stand up for me. And I want you to stand kind of like a ballet dancer with your heels together. All right. Now I want you to do 3 Kegels. So Kegel up, don't worry about your TA, just worry about your Kegels. You're pulling it in, and you're going to feel this in your rear more, right around your anus. Okay. Now I want you to reverse that and put your toes together if your hips allow it. Really flare out your heels. Now I want you to squeeze again. You're going to feel it in your anus, but hopefully you feel it more in your urethra, like you're holding in your pee.
Oh.
Is that true? You guys feeling it that way? Okay. It's just how your hips are. Remember all those hip muscles are also, some of them are pelvic floor muscles. So it just creates awareness, like, oh yeah, but you're going to feel it everywhere. It all depends on where do you initiate it from. So if this is your skin and this is your pelvic floor, you can initiate from the front, you can initiate from the back, or you can initiate from the middle, but they're all going to work as a team. So go ahead and put your feet parallel. Now, when you do a Kegel this time, you're going to squeeze, but you may feel it more from the sides pulling up and in. Almost like they're coming like this. So which one's better? None. They're all good.
Yeah.
And you want to start thinking even neutral. Can I initiate the front more first? Can I initiate the back first? And can I initiate the side or the middle first? And let it go. But once again, the most important thing is, can I relax it? So you can Kegel away, but if we can't get to neutral, it's going to cause problems. So at that point, is my butt tight? Am I overusing my butt? Is it relaxed? Because you don't need that many. If your spine's really loud, which is a whole nother session, is about postural alignment, how it affects your pelvic floor. Anything that has to do with any kind of load bearing with your spine affects your pelvic floor. So if you're nice and neutral and relaxed, you can practice that front, back. You can practice it this way too. It's all good. It's just more, once again, we're creating a pathway from your brain to the leg. We're creating that awareness so that you can use it. You recognize it on any machine you're here. it just becomes a part of your repertoire of understanding your body a little bit better. And that may or may not be useful down the road, but it's always a good thing in just in general. So what other questions came through at me?
Is there such a thing as the reverse of the lock and what you call key and lock syndrome? Like if a friend was telling me she's got this problem, if she feels she needs to urinate, the bladder won't release.
Yes, and that's almost always a tight pelvic floor. Because it's just in this state. If you imagine shoulders again, it's in this
Okay.
state and it's spasming. Or at least in a high tone, and it just won't relax enough to let the pee out of your urethra. And so
We'll talk
that's
about
where if
that.
you're having that problem, that
Yeah.
diaphragmatic breath of truly be able to understand what a relaxed pelvic floor is, you can do a couple of those breaths right before you pee, and it actually really helps a lot.
When I was a child, I could not go pee in a public bathroom. I was so nervous listening to people in the next stall and everything.
Oh, yeah, and
Yeah.
that's not just a child, that's I mean, that's
Yeah.
a very common thing. And pooping in public, good golly, you know.
Yeah.
Right, and then think about, so back to pooping, constipation is a huge sign that you have a tight pelvic floor. I mean, think about it, here's your pelvic floor, oh wait, actually I have let me give you this little handout. The colon, the urethra, and your vagina, or, sorry.
Yeah, that's right.
Yeah,
And that's the guts. And that's the guts
And that's the
part.
gut part.
Yeah.
They all run, and this is a female. I'm so sorry. I don't
It's
have a
okay.
good male, but I'm gonna give it to you because
Okay,
you have
great.
everything but a vagina, right? So what you're doing is it all goes, you have all the same muscles.
Yeah.
It just think about this. They all have to go through this region,
Mhm.
whether they're too weak. And I like this picture a lot because it shows the width of the pelvic floor. It hooks to your pubic bone. And this is just sagittal view, but it hooks from your pubic bone all the way to your tailbone, and all these major organs have to run through it. So if they're tight, it's like hitting a wall. Now, a lot of times, like birthing, even, the baby can't progress. A lot of it has to do with the tight pelvic floor. So, take that middle part out. You can see tailbone, pubic
Mhm.
bone, and all the structures that have to go through it. So it's kind of an important thing. Why we didn't learn about it, I don't know.
Yeah, with respect to the brain bladder connection, I read a piece by a urologist not too long ago, and he was talking about one of the problems. He mainly saw in older patients and men and women, and they had developed a habit of thinking, well, if I feel like I have any urine at all, but I'm like about to go someplace or do something, I better go to the bathroom, make sure I empty it. And over time, they teach their bladder that
They can't
it
hold.
wants to empty
Yeah.
when
Agreed.
and so it's like so you have to figure out how to train it to go, which you can do. So,
Yes,
yeah.
so it's true. So if you imagine that picture where the bladder is, the bladders can hold between like 300 to 500 milliliters of fluid. So you should drink enough that you have to pee probably every 4 hours, but you shouldn't have to pee under 2. So there should be like no just in case pees. If you know you're heading somewhere to the bathroom, there could be exceptions. You're heading down, interstate and, long plane ride or something.
Right.
But usually what you're doing is you're teaching, once again, habitual organ. So you're teaching it can only hold that much. And so then it just always thinks, oh, I'm full, and you're only half full.
Mhm.
I have a great picture of this in my office. And it's like, no, you're really not full. And that's when you go into bladder training. That's when you're like, okay, you're not full. And you talk to it, you send neuro vibes down there and you go, you're not full. I know you feel like you are, but it's okay. I'm paying attention to you. I'm aware. We're gonna unload the dishwasher and then we're gonna pee. Like you literally talk to it. And then that's a slow training.
It's like the pharmacy commercials where the little bladder is like this little character that's oh yeah, they pulling on your arm. You gotta go, we gotta go. It's for those medications that help
Okay.
with bladder control.
Yeah, did I bring this is a belly breathing one, but it doesn't include, this is very progressive. So I'm going to give you both of these. Now this has a reverse Kegel in it. Which we didn't really go over. But I know you guys all know this, but it's just a reminder at home to say, okay, how do I do this belly breath? Just to know that you're, have a reference. I'm gonna give you this other sequence too.
Okay. That was a really good point. Yeah. I think we'll teach other breakdown. Was that actually like significant? Okay.
Thank you. Okay, so, what's his last flyer? I don't know if we got to that. So, this, wait, any other bladder? I mean, I can talk bladder all night, but that was a good question. What did you ask to reverse? Yeah, the reverse.
Yeah, the
urine.
opposite. Yeah.
They're releasing it, they're releasing the urine. Also, the big phenomenon, if you have a tight pelvic floor, is you go to stand up and you can't, you think, am I empty? And you go walk away and you're like, I have to pee again, and you just peed because it didn't allow a full release of the urine. Is another problem.
Yeah, and sometimes I have taught myself saying, don't stay there, because I think I gotta go do my next thing.
Right,
Yeah,
right,
and I'm like, you're done, Missy.
yeah,
Keep going.
right. And then it's such an important organ, it's worthy of a little time on the toilet.
Right.
Right, like it's gonna work for you for life. So can I just sit here another minute? And then maybe try that deep breath. You're gonna do that nice, good deep breath right there. Now, what's not on those flyers is that exhale, that Kegel and that zip up. So I really want, and that's not on the flyer, the handout I gave you either. This is, you know what?
Do you have a card, and where do you practice?
I practice at UPMC in Bethel Park, which I'd rather not be doing, but yeah, anyhow. But it's a necessary, you know what? I do love it because I see a lot of patients that couldn't go to, you know, with the insurance and things that they have. I see a host of post-surgical, I see so many issues. So I, you know, it's a great education. Now this number 7 is a reverse Kegel. You're gonna stop at 6 and 7. I mean, you can practice it, but if you have a prolapse, you wouldn't want to be doing this. If you have a type of a floor, you can keep that.
Yeah, isn't it? But
I never like to suggest there is a deal what's going on with you internally. Michael, I can buy one, right? Yeah, okay. So this kind of described a little bit of what we just did with the TA practice.
Yeah.
Okay, so my hope for you was with this class that you really have awareness of the creating awareness every day, whether it's on the toilet, whether you're peeing, am I relaxing to pee enough? Am I relaxing? If I'm stressed out, the giant eagle, am I relaxing? Like, but you can only do it by that belly breath is the number 1 tool. I know it almost seems too easy, like, oh, it's just breathing. How's it going to help? Well, think about that mechanical. You're thinking about this mechanical of the diaphragm, and it's usually very weak. So you're just thinking, I'm strengthening my diaphragm. It's a muscle like everything else. And the side benefit is I'm relaxing my pelvic floor over. So that's my.
Thank you very
huge
much.
thing. Yeah.
Thank you.
Yeah, you're welcome. Do you have any other questions?
Oh, we get to keep the noodle?
Yes, that's yours.
Wow. Can't wait to go home and tell my husband, I got this and I had to sit up. Wow, nuts to guts.
Is that what he meant to know?
You're gonna think that we're evolving in our programming. I actually would love to take the, I think because of our work here, I would love to take the postural relationship one.
Perfect.
If you have something in mind with that,
Yeah.
because I think that's like
hypocrite.
the biggest, it's like the biggest thing that comes across our plate all the time, but
Yeah.
it's like, you know, we're
It's so
constantly
Yeah.
constantly working on that.
Yeah.
So
love it.
I would like to take that myself.
Okay. All right. That could be your next one.
Cool.
I do think urine is a really big issue for people. So I would like to see a class that just concentrates on urine habits and what are good ones and how.
So like a basic bladder training class, but you can't say that. You got to call it something else.
Right, but you're using true. But it's easy to call it something else because what it is how we're using the TA and Kegel to avoid bladder issues. So we have to figure out how to do that.
Okay.
Just
Because it's such a function of the pelvic
call
floor.
it,
Whether
functional pelvic floor activities.
There you go.
something like that.
You want to
Yeah,
say goodnight
you're
to your,
You're right.
you want to say goodnight to your
Thank you for
virtual
being
people?
here.
Oh, sure. Thank you.
Thank you. This was wonderful.
Glad you're in here, Ashley, Catherine, Kristen, Kathy.
Bye. Have a good night.
Thank you so much.
Welcome. I hope it was helpful.
Very much.
Bye.